All right, welcome everybody. It is Health Talk. Peter Christian back in the saddle again after being gone. And I understand that last week's Health Talk was an interesting topic, especially since I wasn't here. And maybe I should have been, because I understand, John, it dealt primarily with me. Is that right?
It was about planning for getting older. Not that you would need to do that. And I'm sure no jokes were made or spared.
Uh-huh. Are you okay?
Yeah, I am.
All right.
Sounds a little funny today. I like
it does sound a little goofy. Now, you want to be on that one? Does that work?
Sounds a lot better, don't you think?
Sounds good. I don't know. What do I know? All right. So we have a special guest in studio today. It's Bryan Borup, who was actually an EMT. Is that right? Is that right, Bryan?
That's correct, Peter. I'm actually a paramedic.
Oh, paramedic. Okay. So now, forgive me, terms. Let's talk terms.
Okay.
What's the difference between a paramedic and an EMT, or are they interchangeable?
They're not really interchangeable. Basically, the EMT is going to be an individual when they first start into the emergency medical field. That's going to be one of your first certifications. As you progress, you take additional advanced classes, which paramedic is one of those, and that's going to be the one that does the defibrillating that you see on TV, the medication administration, that type of thing.
Mm-hmm. But you're not here to talk about that. You're here to talk about the Nurse on Call program, right?
Absolutely, Peter.
All right.
Definitely the Nurse on Call.
So is that you? Or do you head up the organization, or how does that work?
I lead the department itself. It's actually the Nurse on Call falls under the referral center, which is one of the main departments over at the hospital that does all the transports in and out of the hospital to different facilities, both inward and outward, and then the Nurse on Call is part of that department.
So what kind of calls do you take?
Oh, we take everything from oh, you hit me with that one.
How about my co-host is too old? What can I do about that?
My co-host is beating me with his cane.
I don't think our program has a response for too old, but people call in. Quite often it's young mothers with children. It can be fever issues, earache issues. And it can go all the way up to people experiencing chest pain, dizziness, that type of thing. When we use a program that we basically triage through that to give them an idea of, do they need to be seen immediately, or is this something that can wait and see their personal physician?
Tell you what, I want to try something, okay? And I'm just springing this on you. So would it be okay if we just had a little bit of a nurse call program like now? If somebody had a question about health or health care or whatever, that you and your compatriot could talk about. Would that be all right?
I don't know if you want to do healthcare stuff over the radio, Peter, because of certain codes and things.
Oh, okay.
I mean, it's private information, right?
Well, yeah.
It's illegal for them to give it over the airwaves.
Oh, I see. Okay, but just general, take 2 aspirin and call me in the morning. Tell you what, that's okay. We don't have to do that. But I do understand that some other nurse call programs are not local. In fact, when you dial whatever number it might be, some of those calls can go not just here in Missoula or anywhere in the state, could be anywhere in the world where they kind of farm out who's going to answer the calls. And you never really, it's kind of like Forrest Gump, you never know what you're going to get, right?
Oh, yeah, exactly. Our service here is 100% local. All the nurses are local. So when you talk to somebody on our nurse call line, you're talking to somebody you've most likely seen in the grocery store, whether you realize it or not.
So what ends up with most of the calls? I mean, do you keep track of how many end up in the ER, how many end up getting taken care of that day or night, or how many just get a Tylenol?
We do. We keep track of all of our nurse calls that come in. Like you had said, all the information is private. We don't share that with anybody. We use it only for statistical purposes to kind of help us improve the service as we go.
Okay. We have another guest here. This is Brandi. Is that Brandi?
Yes.
How are you, Brandi?
I'm good, thank you.
Good. Glad you could make it today.
Thank you.
So tell us a little bit about yourself and what you do with the Nurse on Call program.
Well, I answer the call. I work a 12-hour shift. There's several nurses that work 24 hours a day, 7 days a week, and we answer
So that program is open 24/7.
It is.
Wow.
Yep. You can call us anytime, day of night, and we'll answer your questions, hopefully directing you to the right place for care.
So you don't. So if I call, I won't get a message that says, "Gee, I'm sorry, we're not in right now."
No, you may have to hold and leave a message for us to call you back.
Okay.
And that's just because that means we're on the phone helping another Missoula resident.
What's the busy hour for you guys? When do people get into trouble and need to call the health line?
Usually after the doctor's offices close.
Right, exactly. And really that's not necessarily a cause for humor, because many times when you realize, oh my gosh, I'm out of medication, or my daughter or son fell and cut themselves and got a bruise, or something doesn't look funny, or something looks a little funny, I don't quite know what to do about it. That's when we reach out to you guys, right?
Right. That's where we really want to be of service, is to try and get you to the right place or get you the right information when you're in that time of need.
Now, what about weekends? Is that also another time?
yeah.
When, yeah.
Yep.
Because ordinarily your doctor is not there. Obviously, they work probably Monday through Friday, and diseases and accidents don't always work Monday through Friday, 8 to 5, right?
Exactly. And taking Easter, for example, yesterday, the walk-in clinics weren't available.
Really?
So we had, it was really troubleshooting for people.
Okay.
So do you find that it's hard to get information from people over the phone? I mean, there's a lot of things when we get sick or ailments, like I'll be like, Ruth, is this mole a bad mole? And she'll say, well, it's not doing this or this or this or this. But she gets to see it. If I were to describe the mole on my back through a mirror and try to get her advice on that, it might be difficult. Or if it was a rash, is it a splotchy rash? Is it all together? I mean, are those the things that you got to kind of farm out of people that aren't used to talking in medical terms?
Yes, it can be. That can be part of the. It's like a sort of charades. It's a game. You're really trying to get them to narrow it down and get it accurate description, so that we can really do our best to try and direct them. The good news and the exciting thing about technology is that someday we may be able to get that information electronically.
Let me ask you this. Do you think it may be possible? I know that with iPhones, you can do FaceTime. Is that something that may be in the future technology for you guys?
They're working towards that.
Okay, because wouldn't it be nice to be able to see somebody face to face and say, this is what I did to my arm, or, my leg's pointing the wrong way, or,
It would make a big difference, yeah.
Do I need to have this looked at? Yeah, that's going to be a testy end of the line. I would be afraid to be on the other end of that line.
Tell you what, we're up against our first break, so if you have a question for Bryan or Brandi, give us a call, 721-1290 or 1-800-568-5309.
Real quick, can you tell us what the number is for the Ask a Nurse hotline?
Yeah, the number is area code 406-327-4770, and again, that's 24/7, 365.
Okay, 327-4770, is that right? Okay, well, we're going to come right back. So write that down. Put it on your refrigerator or under your phone or whatever, so you'll know. And our number here is 721-1290. We'll be right back with more of Health Talk, sponsored by Community Medical Center from Day One. Okay, we are back on Health Talk, sponsored by Community Medical Center from Day One. Our guests, Bryan Borup and also Brandi Breth, both, is it Breth or Breth? Breth, Brandi Breth, okay. From the Nurse On Call program. Now, Brandi, grab that microphone for a second and bring it right down to where you are. Okay. Now, you just mentioned something during the break that I think people need to know about, and the fact that you are affiliated with lots of other organizations. People Google Ask a Nurse, sometimes they'll get you or someone else, right?
Right. They'll let's say someone in Tennessee Googles community nurse.
Oh.
And so they actually get Community Medical Center, Ask a Nurse.
Sure.
And so I'll get a call from Tennessee, and because Montana State is part of the Nurse Licensure Compact, we can talk to the people in Tennessee and give them some help. So the only issue is that we don't know their walk-in clinics, and we don't have specifics like we do here in Missoula. We know the hours of the walk-in clinics and where they're located. So, but we can help them.
Do we have that agreement with every state or just some? Or
25 states and counting.
Okay, wow.
Yeah.
So I'm curious, when people call in, is there any kind of fee associated? Or obviously you don't even have to live in Montana to call in. So tell us a little bit about that side of things.
It's a free service to the public that Community Medical Center is providing to be just a partner with the community. And so it's free. Yeah, give us a call.
One of the things that I've gotten to know with various organizations I do interviews with on a regular basis, one of their favorite expressions is knowledge is power, right? And if you don't know what's going on with you, or perhaps even more importantly, your child or your elderly mom or dad, and you start to freak out a little bit because I can't handle this, and like you say, the doctor's office is closed, and now people will know that they have this nurse on call program, and first thing you can do is say, okay, just relax, settle down, let's talk about this, let's get some knowledge and information going back and forth, right?
Exactly. And that's a great feeling when I know that I've saved somebody a trip to the emergency room. And when you think about the cost there, not only is it a free service, but potentially I'm directing them to a lower priced option, or even a follow-up with their primary care at a later time.
So you see yourself as a money saver almost for people.
Yeah, I try, but then on the flip side, those people that are calling with chest pain and wanting to stay home, I'm really hoping to help them and get them to the emergency room.
Save money or save lives. I guess
Correct.
Either one sounds like a good end. So what percentage, from your personal experience, what percentage do you think you direct to like an over-the-counter solution or to something they can take care of at home or sleep off? And what percentage, like, hey, you need to go get someone to look at you right away?
That's a really good question. With children, we tend to have them follow up with their provider. We want to really be making sure someone's following that. With adults that have chronic conditions, maybe we can just talk about some over-the-counter medications or, go ahead and watch this and then follow up. So I guess I don't really have a good percentage on that.
So have you ever, and I'm sure this has probably happened, maybe you can describe just in general some things that have happened on the phone with folks where you have had to say, you know what, I want you to hold on. I'm going to call an ambulance for you because there's something going on here that we can't handle over the phone. You need immediate help. Has that happened?
It has happened. We had someone that had called with symptoms of a stroke. And at that time, I knew they were impaired. It would be very difficult for them to dial 911 and answer the questions. And so I was there as a backup to go ahead and speak with the operator as well and to make sure during the intake we get their information. We like to get their address. So then we have that information to send an ambulance if an emergency were to occur while on the phone.
If I remember correctly, the acronym for stroke is FACE. Is that right?
That sounds correct, yes.
Yeah, okay. So you got to make sure you check 1, 2, 3, 4. And if those things are happening, then chances are you're in the middle of a stroke and you need immediate assistance.
Right. And we use a nationally used protocol, a Barton and Schmidt protocol, and it advises us. It takes us through the steps to make sure that we don't miss anything in helping someone get to the emergency room.
So, Bryan, grab the microphone for a second. Now, you've obviously have manned the phone just like Brandi, right?
As the paramedic, we don't give medical advice ourselves.
Okay.
Many times, if, for instance, the nurse is very busy and people are leaving messages, we will look through the messages and kind of do our own pre-triage to make sure we don't have anybody waiting that may have a life-threatening emergency.
So when you figure that out, what message do you give the nurse then? To call this person back or what?
Yeah, we let them know right away so they can drop what they're doing, get in touch with this person, and give them the advice to either come in the emergency department or to dial 911.
Okay.
Okay, we have a couple of questions from Gregan who couldn't stay with us, but one of the questions was refrigerator magnets so that people can find a number if they feel like there's a rush or an emergency. Do you have them? Are they available to the public?
We do have those, and they are available to the public. We have them at the front registration desk over at Community Medical Center. If there are any organizations, for instance, that would like a handful, a dozen or whatever of the magnets, feel free to call the hospital and talk to Robin over there, and we can make sure we get those for you.
So I'm not 100% sure on this one, but I'm pretty sure. There's a story from my childhood. My little sister, who's about 4 years younger than me, we were playing outside, and I caught her eating mushrooms. And so I ran inside, and I told on her, because that's what brothers do. They tell on their sister. And my dad didn't think about it, and he called my mom. Or he called the Ascot nurse and asked what to do, and they said immediately you need to get this stuff and she needs to vomit it up, something to get rid of the mushrooms, because we didn't know if they were poisonous or not, right? Anyway, that was kind of a point of fear, right, for my mom and my dad and for me, because I didn't realize, I thought I was just getting her in trouble. It was real trouble. I guess my question, and Gregan's question was this: when it comes to things like pill identification or poison control, do you guys have access and do you have the knowledge and wherewithal to deal with some of those complicated issues? Like if some kid eats a pill that they're not supposed to have and the parent doesn't know if it's bad for them or not.
Yeah, anytime we have a potential ingestion is what we would call that. We transfer our patients directly to poison control. They are the all-knowing resource out there for us. We don't pretend to understand all the toxicologies of different things. Something like that, we want to make sure they get the best advice as quickly as possible.
That's really important to know, that it isn't just, I'm going to hang up now and call somebody and they'll call you back. You have immediate access to those folks so they don't have to make a separate phone call, right?
Correct, yeah. We will transfer them over, conference them over, make sure they get where they need to go, and we make sure they're taken care of, absolutely.
And so that would go with pill identification too?
That's correct, yeah. Any potential pill ingestions, or, whether it happened or didn't happen, we get them to poison control, and, they've got those resources, so we take advantage of it.
So,
all right.
Brandi, let me ask you another question here. Do you have a story that just typifies the satisfaction? A 12-hour shift is a long time, okay? and I know what a 12-hour shift is like. So is there any particular story that just makes you feel, I'm really glad I'm doing what I'm doing?
There's a lot. I think really I have a lot of satisfaction helping parents that are calling in, let's say with their newborn, for instance, and they've been up all night and they don't know.
I didn't get an instruction book.
That's exactly right. Is this normal? Should I be? And then, or people call, should I be feeling this way? And to just be able to talk to them and really not even necessarily do a triage, but just be a reassuring voice on the other line that it's going to be okay and you're doing a great job. So
do you have training, kind of counseling training and stuff? Do the nurses on this go through that? Because I assume even if you haven't had the training, you kind of have to pick up some of the skills, right?
Oh, yeah. Nursing is definitely, that involves some training that we do get in nursing school, psychology, and we do have some background in that, yes.
So you're probably really calm and collected on the phone.
Well, we try to be.
Maybe Peter and I could be nurse callers if we get the
Not
degree.
me, John! Okay, we're up against a break. We'll be right back. If you have a question or comment, give us a call, 721-1290. This is Health Talk, brought to you by Community Medical Center from day one.